本節目為醫療資訊節目，內容及觀點僅供參考，並不代表本台立場。如有任何健康疑問，請諮詢專業醫療人員。
各位觀眾，我哋今日咧要講解下 sleep apnea 係好 common 嘅，常見到。中國人咧都有好多，大概咧美國有成4900萬人咁多，有好多人咧都唔知道自己有嘅。我好耐嘅朋友陳耀強醫生，我哋識咗好耐啦嚇，
識咗幾廿年啦。咁。So I understand that you have sleep apnea。係啊，好不幸。
好不幸。咁你初嘅 symptom 係咩咧？
初嘅時候咧，老實講自己唔知道嘅，仲成日咧都喺度咧話自己冇試過，因為我咧扯鼻鼾扯得好緊要嘅。我相信好多觀眾咧都有扯鼻鼾啦。咁我太太成日都喺度埋怨，哇！你鼻鼾聲好大，我就話唔係啊，冇啲咁嘅事。咁咧同埋咧兼夾咧好多年來咧我都係。日頭咧好似冇乜精神咁，因為瞓得唔好啊，好多時瞓覺嘅時候咧，忽然間好似唞唔到氣，窒起身，咁所以咧瞓覺咧就個睡眠咧就認真嗰個 quality 就認真曳，咁咧日頭咧就冇乜精神，有時開車咧揸下都瞌眼瞓，直至到有一次咧，我送我女去夏令營啊，翻嚟屋企嘅時候咧，走去電油站入電油，喺個紅綠燈面前停咗咧，我瞓着咗，架車就撞埋去前面架車嗰度。今次就知道弊啦，就走去睇個專科醫生，咁就診斷到有呢個咁嘅病病。
心尾係點樣診斷咗咧？
咁走去睇專科醫生咧，嗰啲就係專係睇睡眠窒息嗰啲醫生啦。咁佢哋咧就同我擺喺佢哋嗰個中心嗰度咧，有一個房係過夜嘅，過一晚夜嘅。咁有好多啲好似 check 你個心電圖啊 ，check 你嗰啲氧氣夠唔夠啊 ，check 你嘅呼吸啊，好多樣嘢嘅。瞓過一晚夜之後咧，佢哋個醫生咧就可以分析，咁佢哋嘅決定咧就係話我係的確係有睡眠窒息呢個病。
係啊，有呢個病。咁你做完呢個 sleep test， 我哋叫做 sleep test 嘅話咧，之後咧又有咩診斷咧？
差唔多嗰個診斷都十分準確㗎啦，即係唔使再做第二啲 study 㗎啦。咁就已經開始要揾辦法嚟點樣糾正呢啲咁嘅毛病。係初嘅時候咧，我就唔想搞咁多嘢咧，就咁試下用啲最簡單嘅，例如好似啲 band A 嗰啲貼住個鼻哥啊，等佢扯起佢，等佢唞氣容易啲。但係呢啲冚唪唥都唔得，直至到後來咧，個醫生咧就說服咗我咧，就用嗰啲叫做 CPAP machine。
仲有冇其他方法咧 ？before 你用 CPAP 咧？
嗱，咁亦都有啲咧，就好似飲食方面啦，即係盡量即係食啲千祈唔好過量啦，即係好多或者低糖啊諸如此類嗰啲，即係同普通減肥同埋普通糖尿嗰啲食譜都差唔多噶啦。做運動有冇幫助？有呢啲應該有幫助㗎，但係亦都好不幸，好多樣嘢咧，我就係叫人做，自己就反而就好懶做呢樣嘢嚇。係啊，要有恆心，真係好難做到。CPAP 咧，英文就係 continuous positive air pressure， 即係將嗰個 air flow 咧就大力啲衝入去，咁咧唔會阻塞嗰度咧經過到。嗰個 principle 好簡單，係，但係做法難唔難咧？唔難。嗱，佢叫 continuous 咧，就係因為你呼吸嘅時候咧，吸啲氣同埋呼出氣嘅時候咧，佢一樣係有空氣入去你嘅咽喉嗰度嘅，咁所以叫 continuous， 一路連續嘅 ，OK？ 係，我有好多病人話，好似俾 CPAP 個 mask 啊，又唔舒服啊，更加瞓唔着覺啊，咁你有冇咁嘅問題？嗱，初嘅時候咧，我而家講下都成10幾20年前啦。初嘅時候嗰啲 CPAP machine 咧，唔係認真太過進步。所以咧戴咧好多時都戴住個口罩，戴住個口罩的確係好唔舒服，同埋咧有時咧你喐下身啊漏氣咧， 就嘈喧巴閉，實際隔離嗰個太太咧，反而仲好煩擾添。OK， 但係整下咧，嗰啲 CPAP machine 咧就越嚟越進步。我依家用緊呢個咧，差唔多可以話靜到咧都聽唔到咁滯㗎。
哦，咁好嘅，
同埋就輕咗好多。你旅行嘅時候咧，攜帶咧好方便。
OK， 咁你用咗 CPAP 嘅 treatment， 你又覺得點咧？個 symptom 係點咧？
依家咧就第一咧就鼻鼾聲咧就減少咗好多啦，甚至乎可以話冇咁滯啦。雖然我太太唔係咁講 ，OK， 咁咧瞓覺嗰個質素咧一定係好咗好多啦。即係依家即係至少用緊係瞓6個鐘頭，真係6個鐘頭，唔係好似以前咁幾個鐘頭就扎醒咗。OK，咁所以日頭咧亦都會個人精神好多。以前咧我記得好尷尬咧，開會嘅時候咧一熄個燈咧我就瞓着覺噶啦，差唔多，即係好唔好，即係好唔好意思嘅。OK， 依家就冇呢啲咁嘅事，揸車咧亦都精神好多。
希望各位觀眾對我哋頭先講嘅感到好有興趣。多謝你 share 個 information 俾我哋。
唔使客氣。
Hi, welcome.
Hi, thank you.
Nice to meet you. Come
Yeah,
on in.
sure.
So, we're going to talk about sleep apnea today. So, sleep apnea is blockage of airway, blockage of breathing, blockage while you're sleeping, and while you're lying down. So, a fundamental way to look at it is it's blockage of airway. Three types of airways. You got your nose, you got your mouth, and you've got your throat. And then the fourth factor is going to be weight. So body size, body habitus. So the nose is pretty simple. Nose, you've got a thing called a septum, you've got things called turbinates, which filter the air, humidify your air, and you've got sinuses, which help humidify and keep your air clean. You've got your mouth. So people have a problem with what is a mouth and what is a throat. Mouth is your tonsils, your uvula, your soft palate. So that is basically your oral pharynx or your mouth. And then finally, throat, which is subtly different, is the back of your tongue and your jaw. So this is the lower part of the airway, and this is usually the most difficult part to treat or to make better. And then finally, we have weight. And weight is very important because besides the fact that you have a lot of weight, a lot of tissue, it's been shown that when people have extra weight, fat gets deposited in the back of their tongue and the lower part of their neck. So this is the exact area down here that starts to block off. So when people talk about sleeping on their back, having a lot of snoring, a lot of tiredness, body weight starts to influence that because fat will be abnormally or exponentially deposited in these critical areas, which then creates more sleep apnea.
睡眠窒息症主要係因為氣道受阻而引起，氣道包括鼻腔、口腔同喉嚨，而體重亦係重要因素。過重嘅人士脂肪容易積聚喺舌頭後方同頸部。當背脊瞓覺嘅時候，氣道更容易受壓收窄，引致呼吸暫停。
Well, these are very interesting. Show us, Dr. Ho, where are the sinuses and where is the tonsils, especially for children?
Okay, so as we talked about, the first airway is the nose. So the nose has a thing called the septum in the middle, which can be crooked, and we can fix that if you need to. Second thing that everybody has is turbinates. These are these little hot dog structures. They filter the air and humidify it. Very large, especially in the Asian community. So if they're swollen, you can treat it with medications, but we can also do procedures in the office or in the operating room to reduce that and to help you breathe much better, quickly, and it's very non-painful. Finally, you have the oral pharynx, the mouth, and you have tonsils. These are the two structures in the back of your mouth. We have adenoids, which sit up behind here, up in the nasal pharynx, the back of the nose, so right at the junction between the nose and the mouth. And in children, that is the first thing to address in sleep apnea in children. Tonsils and adenoids typically are going to be large. Even ones that are not large can functionally make the nose and the mouth blocked. So those are important too, especially in children.
第一個氣道位置係鼻腔，胃中隔如果彎曲會影響呼吸，可以透過手術嚟改善。鼻甲負責過濾同加濕空氣。亞洲人通常比較肥大，如果腫脹，可以使用藥物或者手術治療。 至於兒童，扁桃腺同腺樣體肥大，往往係睡眠窒息症嘅主要原因。
So how can we fix this problem that you mentioned? Can you show us the way to improve them?
Okay. So I'll briefly go over some anatomy. So for your nose, you have a lot of sinus problems. Will make your nose stuffy, a lot of swelling. You may have some structural problems. If that happens, your nose gets very congested. You do a lot of mouth breathing. So you already eliminated one of your airways, which then contributes to snoring, and then you end up becoming very dependent on oral breathing. So dry mouth, throat discomfort, things start to get sticky, things start to get swollen. So sinuses and nose are very important subjectively to make the patient comfortable, sound-wise to make sure that there's smooth breathing, and it does contribute to your overall sleep apnea. Earlier we talked about your throat. So the base of tongue is attached to your jaw. I can even show you the base of the tongue is attached to the underneath to your jaw. So surgery, there are different devices and different things that you can do. A very simple way to do things is to do an oral device. So an oral device is like a dental device. You wear an upper and lower mouthpiece, and it can move your jaw a little bit forward, 1 to 2, maybe even 3 millimeters. That can have impacts upon your sleep. Finally, there are other more invasive type procedures. You can do maxillary mandibular advancement. So you can do something where a trained oral surgeon can remove your whole maxilla, which is the upper part, and your lower part forward, which will then pull your tongue forward and pull your soft palate and your uvula together. So you can put the whole thing together. We have very good trained surgeons here in Northern California and in El Camino. And while it looks invasive, these guys are very good, and it does wonders in terms of your airway.
如果鼻腔問題嚴重，鼻腔會變得阻塞，令到氣道收窄，引致打鼻鼾同用口呼吸，甚至造成喉嚨乾痛。所以鼻腔健康非常重要。由於舌頭連接下顎，睡眠窒息症嘅病人可以佩戴口腔牙托裝置，將下顎微微向前移，就會改善睡眠質素。對於睡眠窒息症嚴重患者，亦可以透過手術將上顎同相關嘅氣道結構向前移動，擴闊氣道。El Camino 醫院擁有經驗豐富嘅專科團隊，幫助病人大大改善睡眠窒息症嘅問題。
各位觀眾朋友，大家好！今日我會同大家講一個大家都成日都想了解嘅問題，就係睡眠窒息症啦。咁今日咧，我哋咧就邀請咗 Dr. Philip Ho。Hi Dr. Ho，Hi，how are you？
Hi，thanks for having me。
唔知大家有冇發現咧，細個嘅時候咧就好容易瞓覺，仲要瞓得好冧添。咁但係唔知點解咧，個人咧年紀大咗咧，就越嚟越難有好嘅睡眠質素。
Yes, unfortunately, as we get older, we'd like to say we get better, but unfortunately, when we get older, things tend to sag a little bit. So things like your nose, you may start with a little slight deviated septum. As you get older, it starts to deviate a little bit. So your nose gets a little blocked up. Your turbinates, which are the tissues in your nose, they get colds, you get allergies, and then over time, they get bigger and fatter, and then they start to block up your nose. Your throat, your mouth, everything starts to sag a little bit. When all those things start to contribute, and then you gain a little bit of weight. And so all these kind of things start to contribute to sleep, and then when they block off your airway, you have obstructive sleep apnea. So if you're sleeping on your back and you've gained a little bit of weight, and all these things, your nose a little bit congested, all these things are going to contribute to making your sleep bad. And then you also have to remember there's also medical issues. You know, people go to the bathroom a lot, or they have some reflux or heartburn. So you always have to remember there's medical issues as well. But unfortunately, as we get older, we start to pick up little things like that.
隨住年紀增長，鼻腔結構鬆弛、感冒、過敏、體重增加等嘅因素，都可能會導致睡眠窒息症。另外，夜尿同胃酸倒流等嘅問題，亦會影響睡眠質素，令人更加容易疲倦。
咁講開睡眠窒息症啦，咁唔知有咩症狀咧，同埋會唔會同其他病症好相似咧？
Well, I think the most important thing, and sometimes people don't even recognize it, is nasal blockage. So nasal blockage, nose is part of your airway. And a lot of people come in and they don't even complain, and they don't complain because it's been building up over time, so they don't even notice. One of the symptoms that you may notice is snoring. So if somebody says he's a loud snorer and he's a restless sleeper, then I start to say, take a look at the nose. Nasal congestion, runny nose, coughing, throat clearing, those kind of things, oftentimes symptomatic of nose and sinuses. Even things like headaches, facial pressure, allergies, seasonal problems. Those are all signs and symptoms of allergies, sinusitis, sinus pressure. So you get into the headache realm. If somebody wakes up with a dry mouth and a dry throat and lips are dry, that's oftentimes a sign of nasal blockage and sleep apnea and mouth breathing. So these are some of the things that you look for in people, and a lot of times people just are used to it because they've been living with it for so long. And sometimes they need to come in and talk to us because we can show you very quickly how life can be without those symptoms. And so people don't realize how bad they are until somebody shows them how much better they can be. And that can be medical or surgical.
想擁有良好嘅睡眠質素，最重要嘅係留意病人有冇鼻塞，因為鼻腔係氣道重要嘅一部分。好多問題都係長時間慢慢形成，而未必察覺。夜晚瞓覺打鼻鼾、睡眠不足、鼻塞、流鼻水、頭痛、面部壓力、過敏同早上口乾等都可能同睡眠窒息症有關。
So in terms of diagnosis, how do people diagnose if you have suspect you have sleep apnea?
So somebody comes in, we see them, we examine them. The way I look at it, we always look at a checklist, right? Your nose, your mouth, your throat, and your body weight. We listen to symptoms. We talk about throat symptoms, nose symptoms. Ultimately, we will get either a CT scan to look at the nose and the sinuses. We can see a lot of things just with a 2-minute sinus CT. And ultimately, we get a sleep test. We get a sleep test either at home or in the lab. And you can measure, are you choking? Are you having blockage of airway? Are you having dropping of your oxygen? So that's more of an objective, and we can decide if you have mild to moderate to severe. And I always typically start to talk about medical treatments, and then we talk about surgical treatments. But that's typically the classic things. If you have there are other sleep entities too, such as restless leg and insomnia and things like that. Those things, we have sleep specialists who deal with the medical portion of that, and that's always important to look at. And we look at labs and make sure you don't have diabetes and thyroid. So there's the overall medical care, and then from an ENT standpoint, we look at surgical as well as physical things that can be treated, and physical things can be treated and made better quickly.
咁我知道以前咧就即係以前點樣去診斷有冇睡眠窒息症啦，就要去醫院度留醫1晚嘅。咁我知道好多朋友啦，即係生活好繁忙咧，照顧小朋友要返工，咁好多時咧都好難去呢個醫院度尋求呢一個診斷嘅喎。So do you think in America there's a lot of people who actually have sleep apnea, but they didn't know they have sleep apnea?
Correct. Yes, it's a much larger problem. It's being recognized more and more, but it's a much larger problem. Sleep studies in the hospital, sometimes relevant, very important. People like Down syndrome or morbidly obese, things like this. But I think the revolution or the evolution of sleep testing is now doing things at home. You can do sleep tests, sleep kits, you've got rings, you've got watches, you've got devices, you've got video devices, you've got apps on your phone that can measure your snoring at night. So there is a technological evolution that is giving us much more information and then allowing us to do it a little bit quicker and more conveniently.
如果你長期有鼻鼾、日間疲倦或者懷疑有睡眠窒息症，應該及早接受檢查。El Camino 醫院設有獲認證嘅睡眠中心，結合先進嘅科技同舒適環境，幫助病人改善睡眠、守護健康，讓你每日都可以瞓得更安心、更有精神咁迎接每一日。
唔該晒你何醫生同我哋講解咗咁多睡眠窒息症嘅知識，我哋而家先休息一陣，轉頭返嚟我哋會同大家講解更多睡眠窒息症嘅治療方法。
Well, we have learned so much about the treatment of sleep apnea pretty much at all different levels. What can we look forward to in the future?
Well, I think the future is here now. As we talked about briefly before, things like treating your nose and your septum and sinuses. You can do these things in the office, and people can just literally do the procedures in an hour and drive themselves home. And their benefits are seen within 3 weeks. We've got things like the Inspire device, where you can put the device in, and a month later you can start to treat the tongue and make things better without surgery. So the treatments are there. New devices are coming out all the time. And so I think we're at an age where that plus AI and technology, those things are going to really revolutionize and give us a lot more options.
最新嘅發明或者最新嘅新興趨勢係乜嘢呢？
Well, interestingly enough, the latest innovation in sleep apnea almost theoretically doesn't even relate to sleep apnea. So bariatric surgery has been around, where they actually reduce your stomach and you lose a lot of weight. And that's been the big talk for the last 4 or 5 years. Now you have these GLP agonists, Ozempic, and Zepbound actually has an indication for sleep apnea. And these kind of drugs you can take at home, you can lose a lot of weight, which really does impact your sleep. So Zepbound is the first drug that just came out that actually did studies designed for sleep apnea. So I think, ironically, it's not surgical per se, but some of this medical stuff is really going to advance the weight and the sleep apnea care.
And I'm hoping the diagnosis will be easier, as you mentioned about the wearable, so not so many cases are being not recognized and undiagnosed. So many of our health conditions can be improved once we know we have the problem.
Right. Wearables are really innovative. Watches, rings, other types of devices. People can track their own health. And I think that's going to be a really wave of the future, where people can just do a lot themselves, even send information to their doctors, even analyze it with AI. So I think that area of care and monitoring is really going to be exploding in the next 3 to 5 years.
傳統上診斷睡眠窒息症需要留院檢查，但現今已經有智能戒指、手錶同人工智能嘅科技協助監測健康。近年治療方向亦包括減重手術同 GLP 藥物，有助改善睡眠窒息症同睡眠質素。我相信好多觀眾咧想知道，究竟點樣先係consider 係好嘅睡眠質素咧？係咪成晚瞓覺唔會起身咧？定係瞓得好冧咧？
Well, what is our dream? What is ideal sleep? The ideal sleep to me is you have a clear nose. You can breathe. You don't have a lot of postnasal drip and runny nose. You don't cough or clear your throat. You don't have a sore throat. You can smell, you can eat, you can taste. In your mouth, it's not dry, it's not irritated. You don't have sore throats. You don't have a swollen tonsil. You don't have antibiotics a lot. And then, we talk about ideal body weight. So can you reduce your weight? And so, traditionally it's been exercise and diet.
隨住年紀增長，好多人都可能有睡眠問題，例如失眠、夜晚經常起身去洗手間。何醫生表示，良好嘅睡眠最重要係呼吸暢順，冇鼻水倒流、喉嚨痛、口乾、扁桃腺腫脹。透過飲食同運動維持理想嘅體重。
So I think the ideal situation is you sleep through the entire night. You can sleep for 8 hours. You don't wake up all night. You wake up refreshed. You don't have dry lips. You don't have dry mouth. You get up and you're ready to go, and you've got a sense of refreshment and a sense of rest.
咁好咧，今日好多謝 Dr. Ho 同我哋分享咗咁多寶貴嘅知識喎。So, do you have anything you would like to add?
Well, I think the important thing I think to people is to look at your symptoms, understand that there are care plans. There are people who can take care of you, and it's good to be sort of systematic and try to have a person who explains to you what is going on. And so make sure to try to address all these different things and not just kind of dismiss it or brush it under the carpet.
良好嘅睡眠對健康非常重要。如果長期避寒、日間疲倦或者懷疑有睡眠窒息症，應該及早求醫。透過減重、改善生活習慣、佩戴持續正氣壓呼吸機同新藥物嘅治療，都有機會改善病情，重拾健康嘅睡眠。
Well, I enjoyed this episode. Thanks to you. Thanks to Dr. Chan. And thanks to Christina, of course. And thanks all of you for watching.
我哋下次再見。
Bye bye.
Bye bye.